Morning, everybody. Back for another AU Core Technical Design group. We're going to be going a lot through ballot reconciliation for AU Core and AU Core R2. I'd like to start with an acknowledgement of country and that we acknowledge the traditional custodians of the lands on which we all gather today, which for me is the lands of the Turrbal and Yagara peoples. And we pay our respects to elders past, present, and emerging, and extend our respects to all Aboriginal and Torres Strait Islander people. And we acknowledge the First Peoples as the first scientists, educators, and healers. Our agenda today is pretty simple. It's all about ballot. We'll do the usual business, a little bit of update news, but then it's about the overall ballot update and then going through ballot reconciliation before talking about what's next, which will be ballot. So it's all about ballot. Going into our usual business, as we always do, we're going to start with approval of minutes. These were sent round for approval some time ago. I'll just click on those to do a quick run through. That looks a bit tiny, so I'm just going to make that a little bigger. Okay, so as always, there was an agenda up top. We've got the attendees listed. We have the slides, the recording, the transcript, the chat log. Then we have the minutes, which have gone through what we discussed, including some of the previous outcomes and a number of the decisions we made, because I think we actually went through 4 ballot items in our last call. So that's what's in the minutes. Does anyone need any more time to review before we move to approve? Okay, not hearing anyone. Um, would anyone like to motion approval of the minutes of the previous meeting? Okay, Rosemary. Thank you, Rosemary. Would anyone like to second?
I'm happy to second, Leonard Riley.
Okay, any other questions and comments while I move to the electronic vote? Okay, just find that now. Okay, if you've got access to the electronic vote, you should see that in front of you. If you can't vote or see it, but you have access to the chat, please put like +1, affirmative, negative, or abstain in the chat. And if you can't see either of those because you've dialed in, if you could say your name and whether you are affirmative, negative, or abstain. I'm going to count that down in 5, 4, 3, 2, 1. I will end that poll. Just check the chat. Okay, with what's in the chat as well, there is 15 affirmative, 0 negative, and 9 abstain. The motion carries. We will approve those minutes. Thank you, everybody. Okay, coming back, we've got a few updates. I suppose these aren't, or at least the next Connectathon date isn't really an update if you've been at the last 2 meetings. So we know it's Melbourne 9-10 of December, but I don't think any of the Eventbrite has actually come out yet in terms of tickets. Brett, do you have any further updates for us?
I don't. I will endeavour to find out.
Okay, that would be great. All right. Then in terms of the next update around AU base, the next set of reconciliation is still really primarily around e-requesting and also foundational content that's not yet marked as must support in AU Core. So they don't impact AU Core and they don't currently impact AU patient summary, though some of that is coming. We have as the AU Core TDG co-chairs, assessed the majority of the tickets and have identified a couple of editorial as being common and passed that for consideration to the AU Firework Group co-chairs to consider hosting a common decision. Looking to get some feedback from them, I think early next week, that we will then either email out or announce in our group. But otherwise, I don't have any other updates. Does anybody else have anything that they would like to announce or raise as an update? Alrighty, let's move on. So here we go. Change of TDG meeting time, or maybe not. Maybe we remain on our current time, depending on which time zone you're in. As we do every year when daylight savings is about to start, and our next TDG meeting will be during daylight savings for Australia, we need to look at whether or not we change to Australian Eastern daylight savings time. We remain on just the Australian Eastern time. A poll came out on Zulip. Now, this is out now. And Shelley, if you could find that link and post it in the chat, that would be great, because this poll will remain open up until about 10 minutes before this meeting ends. And then based on the majority, we will announce what we move to. It's been open for a week. There's a few people who voted, but I think not that many. So just putting that out for the people in this meeting. Please vote on Zulip as soon as that link is in the chat for what the meeting time is going forwards. And yep, it's in there in the chat. Thanks, Shelley. All right. Reminder, the next CDG TDG day is coming up. There are still a few tickets left, but that's really closing rapidly. So if that's something that you're interested in for November 12 and 13, please make sure that you actually get in the next week or two around that before the tickets close. Last reminder here, or actually it's not a last reminder. So the AU Core 3 backlog, we've had quite a few submissions already, which has been pretty awesome. But we need to go through those and present, and this is for November as well. People who would like to suggest items into AU Core 3. Whether that's new profiles, whether that's new capability statements or actors, whether that's actually a new set of search criteria information, which is one of the pitches that has come through. Can you please submit a EOI if you're going to be able to be there at the November event to come through and present on I guess, what it is that needs to be done now and why, and what would be involved, so that we can shape that into AU Core R3. Because I think we're coming down to the end now of AU Core R2, and we want to kick off AU Core R3. I mean, as soon as we finished R2, which is really the point at which ballot reconciliation ends. So ideally, our end point for that is end of October, and then we start AU Core R3 kind of scoping and discussion during November and start carrying that through. So start, please, considering what is it that we don't have now that you want to bring in. All right, I think that brings us into what is still here on a ballot update. Perfect. All right. Bring this into ballot update. That's not changed. This is just for those people who've missed it. We're now in ballot reconciliation. We are looking to complete ballot reconciliation decisions at the end of October, if possible. We are looking to then bring through a normative snapshot into the December Connectathon to test that, and then also looking to publish at the end, really, of January. We have met the ballot criteria for publication. So the consensus body formed through HL7 Australia has voted affirmative, which gives us that approval. We already know we don't need to go out to reballot. We still need to work through all the ballot feedback, both affirmative and negative, and we're doing that now to determine what changes we make in this particular release and then what moves into potentially the next release, and also what do we think is actually not relevant or appropriate. So looking at where we are with our JIRA issues, overall, in terms of our ballot, there are 19 individual pieces of feedback that were voted on as needing to be considered in AU Core R2. Of those, the AU Core TDG co-chairs have gone through 14 of them, so that's 74%. We as an AU Core TDG have already voted on or made decisions around 6 of them. And in terms of being already applied, there's still 0, but that is going to happen very soon. Actually, the IG editors are working through those, and we should see that number shift in our next call. What that looks like in terms of our schedule. So we've already had one ballot reconciliation meeting where we voted on 4 items of feedback. In this one, we have another 4 items up for discussion. In our next meeting, we're going to go through probably another 3 or 4. Why that number sits at 6 is because there will be an e-vote coming out soon for the group to consider. It should be out Friday, I think, an electronic block vote for people to go through. And then ideally we have only a small number to go through at the very end. And that then brings us into completing our ballot reconciliation for R2, and we can move into an R3 space and starting to consider that in November. Okay, I'm going to move past these things pretty quickly. Just quick reminder, there's an R2 scope. Our set of work we did around R2 was around medication statement, healthcare service, and related person. There's already a bunch of content in R1. We also did some AUCDI mapping on medication use summary, and there was a number of enhancements that were included. So that's the scope and what was under ballot. As we go through and make some decisions on this content, we also have to consider whether or not things are out of scope, whether or not things are applicable, how much work is involved. So coming into our dispositions that we're about to vote on, as we consider each item, we can make one of these choices. We can decide that something is not for change in this release, but should be considered from the next release onwards. That's considered for future use. We can decide that what is raised, we want to change basically as is, which is persuasive. We can decide that someone has submitted a change, but there's maybe more work to be done than what was prescribed or somewhat different than what was actually suggested. That's persuasive with modification. Non-persuasive is where we don't agree with what was raised or the outcome. Non-persuasive with modification is where the item that someone has raised is not persuasive in its argument, but we will still make a change to AU Core. That's often where we want to clarify things. So someone may have raised a suggestion that AU Core, I don't know, does A. And we may have a really strong position that A is totally not appropriate, and here's why. And we might therefore make it not persuasive with modification by saying that we don't agree with that, but we will update the AU Core specification to state why that's not the pathway forwards. So those are the dispositions that we will need to be considering as we go into the actual ballot reconciliation. And at this point, I should hand over to Landon. Would you like to share your screen?
Yes, please.
Over to you.
Thank you. And clicking shared, just confirming, can people see my screen? Can people hear me?
Yep.
Perfect. Okay, cool. I'm working through 4 ballot items today. So 3 of these are very similar. So I guess some of my hope is that if we kind of get consensus and we talk through one of these in detail, we can move through the other 3 fairly quickly, because they're all very similar, if not the same. It's been pretty much a copy paste from the juror tickets and even the dispositions. All right, I'll move on to the first one and I'll try to talk through this. So there was a ballot item raised around inconsistencies and referencing encounter versus AU core encounter across AU core profiles. So I've summarized this in a manner which is more easily consumable for a slide, but I can refer to the slide. Actually, we might quickly do that. Might be a touch easier. So this is the juror ticket here. It was raised by Stephen. There's a disposition which I have in the slides. I've summarized the description. It was voted on by a number of people with negative votes, and there were some comments. So if I talk through the summary of this ticket, it talks around mixed target profiles for the same element across AU core. So for allergy, intolerance encounter and condition encounter, it references encounter, as you can see here and here from that example. And procedure encounter references AU core encounter, as you can see down here. And the question is that this is is this an inconsistency or an intentional pattern? And there was a request in the description that if intentional, document the rationale. If not intentional, request to harmonize. So with these examples below, I guess we can see, I might just highlight the differences in these. So for allergy intolerance encounter, that is not must support. So that is a reference encounter. And for condition, that is also not must support, so references encounter. And for the other one mentioned, the procedure encounter, this is must support, and that has obligations associated with it. So the primary difference here is that using the AU core convention, that must support items are constrained to the AU core profile type, as we can see here. But that's the primary difference. But I'll go to the next slide. And this talks to some of the discussion points that were in the ticket. And I'll talk through these. So the first one is an AU core. I think these were mentioned by various people, but we can refer to the ticket if we choose. I think it was like Danielle, Heath, and a few people from the agency. But there's just a general points. So in AU core, we only constrain elements that must support. That is the convention. Therefore, procedure encounter is must support, so it's constrained to AU core encounter. And by contrast, allergy intolerance encounter, condition encounter are not must supports. They remain unconstrained to reference encounter. And there was some previous ballot items that discussed having these as, well, removing the must support from these items. So I think these tickets here for condition encounter and allergy intolerance encounter, I think there were previous items that removed the must support from these, which is now why they're reference encounter. So the mixed targeting at this point, due to conventions, is intentional and aligned with the AU core practice that we only constrain must support and leave non-must support elements unconstrained. So I'll go now to the dispositions that the AU co-chairs landed on. So in short, in summary, I guess this reflects the AU core convention, constrain only must support elements, and respective prior ballads, which remove the must support from those elements. So we landed on disposition of non-persuasive for this one. But what I might do now is I might open it up for questions or discussions. That's just an overview of the ticket. Danielle.
I'd just like, so point of order, the original draft of AU Core R1 had must support and these profiles in it. Through the ballot of AU Core R1, it was voted on by this AU Core Technical Design Group that that's not actually what we wanted. And therefore they're not present. What this means, though, is that to reopen these would require a revisit as point of procedure, and the revisit needs to address what's different now. Why would we revisit this decision? Which would look at things like different reasoning or any kind of changed circumstances. Otherwise, we wouldn't reopen the already balloted decision.
Thanks, Danielle. Is there any other follow-up questions?
I have one question.
Sure, go ahead, Mandy.
If I have been involved in desensitization for allergies for specific patients where, for example, they're allergic to penicillin and they need to be desensitized for a specific procedure or condition, how would that be incorporated when this ballot is active? Would there be an option where we can make notes or adjustments to allergies and just
Apologies, Mandy. I think in terms of ballot reconciliation, we need to keep that to the issue that is raised. I think at the moment when we call for other agenda items, I think that's where we can raise that question. And could you pop that question in the chat so that we can then include it on the agenda?
Sure, thank you.
Okay, was there any other comments or feedback? Okay, given that I'm not hearing any other feedback, I might put forward a motion to accept this disposition of non-persuasive as it stands.
This,
sorry, go ahead.
to a degree, becomes a little bit difficult because this would be a revisit.
It would be a revisit, okay.
So before we could disposition, which would open it up to be changed, we would have to treat whether or not we reopen the original questions. So I think in terms of a point of procedure, I think you would actually be saying that you're motioning that it's not persuasive to revisit those two JIRA items of 45123 and 45189.
Yes, that can be my motion.
Okay, could you restate it for the record?
Okay, I'd like to state that I would like to nominate this as non-persuasive to reopen the previous ballot items 45123 and 45189.
Okay, thank you. We have a motion. Who would like to second?
Happy to second that, Ricardo.
Thank you, Ricardo. Are there any other questions and comments before we go to a vote? Heath.
Isn't this more about the profile that's being referenced, more so than whether it's must support? And those cards are more about revisiting whether they must support.
The current. Okay. So are you suggesting this isn't a revisit of the previous ballot items, both of which you raised, Heath, which were to remove must support from allergy intolerance encounter and condition encounter, which also triggered the removal of the AU core encounter profile, because we only do that when items are must support?
Correct.
Did you want to revisit your decision?
I don't want to revisit the must support, but the issue that's being raised by Stephen, I thought, was that he wants it to be an element that is not marked as must support to be referencing an AU core profile, but we have a pattern where it's not. So it's more about.
I didn't think that was necessarily the case. The comment is it's unclear why, although I think that there is a clearly communicated position that only must support has AU core profiles referenced.
After Heath, I do have a comment to make though.
Please go ahead, Stephen.
Okay, look, the ticket that I logged is not about revisiting a previous ticket. Is about providing clarity to the inconsistency. So specifically, the ask was that if this is a deliberate design pattern, then provide some clarity on it. I'm not asking for the ticket for the previous ticket to be revisited. Is about the ask is about whether or not these are deliberate design patterns, and if they are, then provide some guidance or clarification. So I find it
taking this is one instance, but there are many, many elements that aren't must support that could be typed AU core profiles but aren't. What would be your suggestion for a preferred way to provide clarity that would encompass not just this, but I guess that approach?
Probably at the IG level, not necessarily at the profile level, provide a statement about why sort of the difference. Perhaps like, say, for example, in the context of the decision about for those that are not declared as must support, the profiles that are being referenced would not be the AU core profiles, would be generic profiles. So an explanation like that would be useful.
Perhaps similar to AU patient summary that has a profiling approach section that links off to the profile design principles. And we do have those for core. We could link off to the profile design principles for core that provide that information around the fact that only must support elements are referenced. Would that be suitable?
Yeah, something that provide a bit more clarity would be suitable. So I don't think that in that case, then the disposition would be not persuasive. Would be persuasive with more because the ask was not about revisiting the ticket that has already been voted on. The ask is about providing clarity.
Okay, thank you for clarifying that, Stephen. We'll go to Heath and then Richard.
I was just trying to clarify from Stephen, but I think it's becoming clearer whether the inconsistency is related to when an encounter reference is must support, or whether it was the inconsistency in the profile of the reference for encounter. And that's, yeah. The way I'm reading what you've concerned about in this card is the fact in one place where it's must support, we're referencing an AU core profile. In other cases where it's not must support, we're referencing the base resource type. And hence why I don't think it's a revisit of the must support decisions. It's more about saying that it is not persuasive because this is our pattern that is already specified in AU core.
All right. Thank you, Heath. Any comments on that, Stephen?
I mean, I don't want to go into a protracted conversation about this. To me, the ask is not about. It's very clear that it's not about revisiting the ticket that has already been voted on. I'm happy to sort of go along with the disposition of the group, but I just want to make it clear about what the ask is.
Okay. Thank you, Stephen. Richard?
Finding my mute button. I like the resolution so far. Where do we say in AU core that the pattern is that you don't constrain must support elements?
I think we don't have
okay.
a
It's not
profiling approach section yet.
Right.
As we do in AU patient summary, the pattern has been, as it is in most work groups, but not all, is to have a agreed position, document it somewhere in your working notes like Confluence, which we have, and then just let people search for it if they want to. But I have gotten the understanding that this would, although it's phrased as encounter, it is wider than that, would potentially result in saying that we add a profiling approach section to AU Core that, like AUPS, links off to the profile design principles that talk about, well, what this is, that we've agreed as a group that only must support elements are typed to AU Core profiles.
Right, good, clear. Yeah. So at the moment, we have a policy position. It's documented in Confluence. If you come at the IG cold, you can't find that policy guidance. So maybe the idea is we want to have some way to find the policy guidance within the IG, whether that's guidance is in the IG or whether it's just pointed to from the IG, we're yet to decide.
Yes.
Okay,
And
thank you.
neither is wrong. There's a lot of arguments about not loading up the content specification with the how did we get here.
Yes, indeed.
There's a balance.
Yep.
Yeah.
Too much means you can't find what's important.
Yeah, if we think about it from a differential perspective, like we basically say nothing we're not changing anything basically on things that I guess to some extent we don't care about. You can do as an implementer, you can use it, you can do what you want with it, and AU Core is saying nothing about it. And literally we are saying nothing about it. Hence, this is not persuasive.
Oh, I like the policy of not constraining things that we don't have much support on. I think that's where we should land. The only thing now is where do we explain that, if anywhere? Yeah.
And so my assumption is actually the proposal from Stephen is to incorporate a profiling approach section that links off to / summarizes the policies of profiling of AU Core. Would that be what you're going for, Stephen?
Yep, sounds good to me.
Okay. Would you like to make a motion, Stephen?
Well, I'm happy with what you have just said. So I haven't really remember exactly what you have said. So if you want to say that, then I can motion on that.
I believe the motion would be to add a profiling approach section to AU Core that either links to or restates the profiling policies adopted for AU Core.
Yep, I'm happy to motion to move that.
So are we changing this to not persuasive with mod with that modification? So the existing
I think
with the
so,
existing
yeah.
resolution with the modification to say that we will add some general guidance to say that anything that is not must support, we don't further constrain.
And that's
I think
what
so.
yeah, and that's what I asked for originally. Anyway, I just say that look, if the pattern is deliberate, then provide some clarity.
Mhm. Would anyone like to second the motion?
I'll second the motion, Richard.
Okay, Stephen's motion, Richard seconded. Any other questions or comments before we move to the poll? Okay, I'm going to attempt to launch, except I have not managed to launch that. That's very interesting. Why? Okay, I have figured it out. You should now see the electronic poll for the vote for the current motion. Please vote affirmative, negative, abstain. You can put your vote in the chat of +1 affirmative, negative, abstain, or if you can't see either the electronic poll or access the chat, please say your name and affirmative, negative, abstain. Now, only 60% of participants have voted, and we're going to wait until a lot more have. Getting closer, 75%. Ooh, we've jumped above 80. A few more seconds. All right, I'm going to count that down in 5, 4, 3, 2, 1. I will end that poll, share the results. And with what is in the chat, we have 20 affirmative, 1 negative, 6 abstain. I would ask if the person who voted negative is comfortable with sharing. For the minutes, could you state what we should record as the reason for the negative vote?
I just don't think we need more guidance.
Okay. All right, let's move on to the next item, Landon.
Awesome. Thanks, everyone. So there are 3 related ballot items that are fairly similar, which we'll go through, but I'm hoping if we kind of come to a group decision with one of them, it might apply to all of them. So I will talk through this one. So I've summarized the description. Actually, I'll go to the juror ticket. All of these juror tickets are very similar. I've summarized it in the slides. I had a number of negative votes and there was a bit of a discussion, but I'll just go to the summarized version here. If I can reload this. Okay, cool. So in short, this one talks to that in R4, there are 5 data types for onset. There's daytime, age, period, range, and string. Now, AU Core constrains this data type, well, constrains to 4 data types and excludes string. As you can see here, there's no string, but in AU base, there is a string. So the concern here was that this string enables the fuzzy capture of patient information, and it was unclear as to why it was removed. And the suggestion here was to provide guidance on why string is constrained out or do not constrain out the onset string. So that is the gist of the actual ticket provided. Now I'll go to I've summarized, as per the last ticket, a summary of the discussion in the chat. So the onset string has been omitted since an early version preview. I think this was based on a vendor survey, which is in this link here, which indicated that most systems support date time only, and there was no declared use of onset string. We also opened a Zulip poll about 2 weeks ago, and we had a number, and we went out to the community and asked who actually uses these in their real world production systems. We might quickly go to that poll now. I think I got it loaded here. So the results from this poll were, the question was related to these ballot items, who uses
We're not seeing it, Landon. We're only seeing the PowerPoint. Oh, no, hang on. Now we are. Can you zoom in a bit on that one?
Yes. Does that help?
I think there's a several seconds delay, so
yeah, no, that's really good.
Yeah.
Awesome. So with this poll launched on the 19th of September, there was questions around who uses this related to these tickets we're talking about now and their production systems for condition and allergy intolerance, whether they used it with condition onset string or allergy intolerance onset string, both. They don't currently use it in their systems. They don't implement onset at all, or they just put it in the notes. And we had feedback from a number of different vendors that they just currently don't use it in their systems. So that was the result for this one. So we had, 6 participants say
So that feedback is GP, hospitals, and apps, basically. That seems, I know it's only 6, but that's not bad.
So my question then is that are those profiles supporting only information systems such as EMR and critical information system use only, and you would practically in that case exclude patients who want to document their patients' own allergy, intolerance, and also condition information, where they want to document some fuzzy onset timing, and they are not able to do that. So when we are talking about empowering patient, we are actually excluding empowering of the patient by saying that because system out there don't use the data type, and so therefore they will not be supported. Is that the position that we are going into?
I will go to.
I think that's an interesting framing. I think the framing is, what is the argument and who wants to use it? Nobody is using it. If there is a use case, I mean, if the agency, for example, is looking to implement this, then they can speak up on how and when they're going to implement that. It's not about always prohibiting it. It's not there now. It's not in AUCDI. Nobody wants it. Nobody's using it. Why would we allow it? Is this an ivory tower argument?
No, it's not an ivory tower argument. I want to also to make it clear that what I'm saying is not the agency's position. I'm not putting my agency hats on. This HL7 International Patient Care Work Group owns or is the custodians of condition resource and also allergy intolerance resource. We went through months of convoluted debate over the onset daytime and also the recorded daytime, and we have received multiple arguments that those fuzzy timing would be needed because patient poor historians, they have very often receiving secondhand information from their parents, etc. And so therefore, that kind of fuzziness needs to be supported.
So if I was to speak for best practice, we wouldn't actually be able to process this or even store it. Like we would have to force it into notes. We wouldn't be able to retrieve it. So for a lot of these systems, we would have to just omit it. Or if it's in notes, then it's valuable. So our preference would be for fuzzy. And a lot of the fuzzy stuff can be put into data structured as well. Like a lot of it can be modeled, and maybe there's more guidance required around that, as opposed to just allowing anything, which is fundamentally a note. Anyway, we'll go to, I think Richard was next.
Yeah, I've got a couple of thoughts here that I think are relevant. One is talking about supporting, that comes through the must support attributes and tags we put on things. So he said you've got to support the data element. The only data type that you have to support is date time. So it's it's acceptable to produce this, I think.
Hang on, Richard. There's two actors. One is AU core responder, one is AU core requester. The specific must support on date time only kicks in for responders. Requesters, as in I want to know onset information, are forced to support all data types.
Oh, okay, right. Okay, that wasn't obvious just on the quick glance there. Okay. What I was thinking about by leaving out the data type from this, we are in fact saying it will be syntactically invalid to include a string. So it's actually quite a strong thing that we're doing by saying, by dropping string out in this way. We're not saying that you don't have to support it. We're saying you're prohibited. And I just wanted to make that clear.
Hey.
Just a note, this has never been in AE Core right from the outset. Either very, very early previews, this element has never been there. So it's been not even considered. And again, it comes back to the systems and probably some best practice. And I guess there's two different trains of thoughts. There's the clinical best practices, as Stephen is alluding to, which is really important. But then there's the best practice around trying to structure data for clinical use and analytics and all those sorts of things. So, you know, it's a bit of a challenge in this particular case where, yes, we want to support that. The consumers need to be able to record something, but it's not very useful in that data element to be able to run analytics and the like on it.
Here, you don't always need to run analytics on everything. Right? A lot of the time, a piece of data which is unstructured, if we can't structure it, provides a huge clinical utility to the people who use it. Right? So I'm not particularly convinced that by the argument that because system out there can't process it, so therefore they should be excluded. We go back to the 80-20 arguments with FIRE internationally, and even folks like, well, I won't name the folks who are very adamant about the 80-20 rules didn't object to the inclusion of the string data type in onset.
But unfortunately, we've got very strong obligations to say that a consumer shall handle every data type And that includes those that might want to actually consume a patient summary into their system, into their database. So you're putting that onus and an obligation on every consumer that wants to be able to actually bring allergy information, condition information into their database. And that's a pretty strong obligation. When we know from the poll that none are doing that at the moment, have the capacity to do so.
Yeah, I do want to just chime in from a implementer perspective. It's not there today, right? It's not something that anyone's currently using. We did check with the poll, and as Danielle alluded to, we have a good smattering of different implementers across the board. It's constrained out today. No one's implementing it. We do have processes, as a core group to re-raise these things. If someone comes to a Connectathon and says, hey, we are actually using it, here's a use case, here's a demonstrated implementation, etc. We do have a process to revisit things and re-raise them, rescope them in to say, we now need to omit that, etc. And I don't think we should, let perfect be the enemy of good enough right now. We're focused on, the AU core. What is the things that the majority of people are using? Is there a demonstrated implementation? What are the things necessary currently? So I don't see this as something that needs to be dug into without, really any concrete examples. And once we do have those, we can bring them to a Connectathon. We can, we have a process to reopen these things and look at them then.
Great. Thanks, Andrew.
Thanks, Andrew. That we have Richard and then Heath.
I agree with, from what people have said, the idea that requiring everybody to support string would be very hard, and it's not something to do as particularly casually. But I think the actual obligation in AU Core is simply to no error, which is a pretty low barrier. So I think if we're saying don't include it because people might have to implement, because people might have to process the data, I don't think that's actually the application. I don't think that's actually the obligation in core, though it might be the obligation we want people to follow.
So a very quick response to that, but as soon as we inherit that into AUPS, we now are into handle. So it's got downstream implications. The point that I would just want to make, I'll put a link to the wiki page, which is the vendor support poll that we did probably last year as part of AU Core around onset. And one of the things that Oracle put in on theirs was that they have a date time plus a precision flag. So I wonder if our usual precision extension is a better way to manage this rather than dealing with the, I know we use the term fuzzy, but some of the examples that we've been talked about was, they're in kindergarten and those sorts of things. So they're very, very fuzzy. They're more than fuzzy in my view.
All right, thanks, Heath. And then we've got Brett.
Yeah, I was just going to add, I think just if we don't have a string onset value, it would be quite reasonable to include information in notes. And you do lose the context of it being the onset. But as far as usage goes, I mean, it's achieving the same outcome. You can state onset whatever in the notes. You can read it. And that's all you could ever do with a structured onset string anyway.
Cool. Thanks, Brett.
Thanks, Brett. Would anyone else like to make any other comments?
The obligations in patient summary are not AU Core obligations. They're different actors. So the fact that it becomes a more stringent one on an AU Core actor, does that automatically follow to AU patient summary actors, that AU patient summary
Yes,
is
it
defined
does.
in a way?
It's one of the dangers we need to be careful of when we're making AU core changes, that some of these will flow down automatically and have much stricter obligation impacts, and yet does automatically. So yeah, we do need to be careful of that. This is actually a minimum requirement. Is it a minimum requirement for Australia that string is present? I suppose if no one has any other comments, I will add my 10 cents. If other people do, please go ahead, and then I'll add my 10 cents later.
Sorry, Neil here. I guess implements, like as we said, we already voted that we don't support it, but I can see the flip side of it. He added it to notes. There's no, in our system anyway, there's no linkage between the condition record and that clinical note. So if the note was added, say today, and a year later you look at the conditions, it's hard to find that link between that condition and the note. I guess I'm seeing both sides.
Which, can I add a clarifying question then? For those people who said no, did you actually mean resource like .comment, or did you mean incorporation in a clinical notes record?
Oh, I meant in the resource. Yep.
Okay, so that might be allergy intolerance dot. I don't know if I think it's like .comment or .note.
Yep. I think they both have options for a note and or comment. Yep.
Okay.
That makes sense then.
Yep.
What I might do is I just might talk through, and just to keep the conversation going, I might just put the position of where the co-chairs came to with their disposition. I'll just super quickly talk through this. So the co-chairs landed on a disposition of non-persuasive. So the original, this is because of the original vendor consultation, as Heath put in the chat. So AU Core prioritizes computable interoperable exchange. So we kind of felt that the free text kind of lacks consistent, queryable, and clinical decision support. The preference is to use onset date, time, age, period, and range. And you could possibly put it where needed fuzzy stuff inside of the allergy intolerant note to keep the context or the clinical context and data integrity. And I guess from my 2 cents as well, if no one's implementing this, I'm not sure there is a reason to include it now, because I don't think many systems can support this, and it would be an extreme challenge for best practice, for example, to try to attempt to support this. And that's my 2 cents on it, but I might throw out now for further discussions now that I've presented the co-chair's disposition.
Thanks, Landon. Would anyone else like to comment? And I do have some comments I would like to make, but because I'm chair, I need to leave those to the end of the community comments and questions. Okay. I would like to suggest that this actually sounds like consider for future use. It seems like for the scope of the release that we've built, developed, tested, string is something that is being marked as potentially relevant, but has some serious normative impacts that would be concerning, that can't just be a feedback on current release. I see even in the disposition here, the position we may get to if we do consider its inclusion, to actually provide advice in AU Core that it goes into note, which could be a way that it would be included in a release. So that's probably my feedback on this, that it's less not persuasive and it's more not now.
I support
Back
that.
to you, Landon.
Okay. I support that. If there's a use case that's presented where it's viable, then we can certainly revisit later. It's difficult now, not necessarily difficult in the future. Is there any further comments or questions? Actually, you were probably the last one, Danielle, but would I be able
but I suppose I also want to clarify, I know we've got narrative since childhood, but text can be exactly the same as date. It's June 1999, but it's just not in date format. It's string. It's exactly the same, but in string format. That's also what would be allowed by having string. So it doesn't have to be these concepts that are impossible to capture through other data types. It's the other data types information just in a string format. And I guess that's a consideration too, as to whether or not we would want like 19th of June, 1996 as a string, rather than saying, no, that has to be a date, thank you.
That's my concern. We start getting actual dates as strings in all sorts of formats.
Yeah, I think that's a reasonable concern. So should we check whether or not, from a community perspective, okay, Landon, where would you like to, I guess, motion? Would you like to motion? Are there any other comments or questions people would like to state on this?
Just a question
Keith.
about your future, consider for future use. I guess that kind of means that, for me anyway, that at some point in time we'll come back to it when we've got time. Now, whenever that might be. Whereas I'm hearing like some of the comments, and certainly I'm in that camp, that until we've got a real use case, real need, whether that comes from the agency or consumer groups or whatever, and we're able to then consider it properly, let's just put this to bed to say that I would rather say, nah, there's no persuasive reason to do this when we've got an alternative, and until we've got an absolute good example of what it's going to be and whether it's estimation, extension, and all those sorts of things, then we look at it then. But I think we're just looking at some maybe kind of scenario here, and I don't think that's what AE Core is about.
Which, to be fair, even though I've provided my comments at the end, that is what I'm hearing from the majority of people who have spoken. So does anyone have a differing comment from that, from what we haven't yet heard, to add into that mix?
Just a comment of interest. I don't believe that future use impose any timeline on that. That's my understanding, unless sort of your interpretation of future use is different, Eve.
And that's quite likely. I kind of find that concept hard to deal with in my head, to be honest, because it's a resolution, but it's not a resolution.
We can already mark it as something that we do not support. That doesn't mean it can't be revisited. To be reopened, it would need a persuasive argument that is substantially different than what we've already provided, which I think is what has actually been asked for from the people who are saying non-persuasive. They're saying, I'm not hearing someone who wants to implement this. Tell me why and what you want. So I do think they're both procedurally appropriate. Sorry, Mandy?
Sorry about that. I'm kind of confused. The reason of this not being core, I completely get all the points that are made and I agree with you. But one thing that comes to my mind, which is the interoperability between systems, if this should be applied and that's going to fail. What I don't want is an incident where people, due to severity or sort of busyness of their job, won't be able to go back onto their notes. And people who access the system, for example, if there's an allergy to peanuts and somebody is giving a child a peanut butter, we had that incident few years back in one of the hospitals when one child actually had very fatal consequence of not adhering to the allergies because the motion of allergies or the onset or the severity was lost between translation in notes and not on the system. So if that is something that could validate a not now but later as a priority comeback, that's my sort of kind of concern. But otherwise, I completely agree with you. I think that was what I wanted to say regarding any different scenario where it would make us think about this as a core AU core or as just a note, and if it is a valid risk to be not kept and just moving on. Sorry, I'm I'm kind of I hope I made sense with what I just said, but the bottom line is I don't want a critical incident when it's not, people don't read the notes and don't follow up on core allergies.
Thanks, Mandy. Heath?
I'm happy to put a motion forward to this existing disposition, but before I do that, I just want to go back to Mandy and say I actually do have an allergy that I had in primary school, and I can't give you a date, but I don't think it's going to affect the severity of my allergy. The fact that it was in primary school versus not having a date at all. It's just simply a statement that I've got this allergy. No, I don't really know what the date is, so that's just as, and that can go in the note, but the severity of my allergy is more important than the fact that it was last week or last month versus in primary school.
Well, if an allergist will disagree with you, right? People do grow out of allergy. If you have an allergy that is in the childhood, 30 years ago, it might not be the case anymore. But let's don't go into a more protracted debate. But I just want to make it clear to you that that is not clinically insignificant.
So I'll motion.
I think we're going to bring this. Okay, sorry.
I'm motioning this non-persuasive.
Okay, Heath is motioning non-persuasive. Would someone like to second that?
I would like to, Landon Riley.
Landon. Who would like to? Okay, would anyone like to have any further comments or questions before we move to a poll? Okay, I'm going to launch the poll for the current motion of non-persuasive. You should see that in front of you, affirmative, negative, and abstain. And obviously you can put your vote in the chat. And you can also, if you've dialed in, state affirmative, negative, or abstain. Okay, I'm going to count that down in 5, 4, 3, 2, 1. I will end that poll. I will share the results. So with the vote in the chat, we have 17 affirmative, 1 negative, 6 abstain. For the negative vote, if you're comfortable, please confirm the negative position to capture in the minutes.
I'm not convinced that prohibiting the data type is the in core is the best way to go here.
Okay, thank you, Richard. All right, we can move on to the next item. We may have to speed up a smidge, but they are similar, so we might be able to move through these.
I think so. They are more than similar. They're almost identical. The only thing that differs is the resource itself. So there's 2 remaining tickets. There's Condition.onset, and I think there was, is it Condition.abatement might be the next one. But it's fundamentally exactly the same issue. So I'm probably not going to spend too much. I did replicate the slides, but I probably won't spend too much time in going through the things we just discussed because it's pretty much identical. I think there was one difference between Condition.onset from my analysis of the ticket itself, And I do believe, because it was the same comments, the same Zulip poll, which would encompass this. There was also the same results from the vendor survey that we had previously. But I do think there was one comment from Tim that was provided in this, which was only provided in this ticket, that wasn't provided in the other three. So I thought that was noteworthy to include this in the discussion as well. And I think what this was mentioned by Ruben, I think this was just pointing out the requirement to support the fuzzy values from a UCDI release 2. So partial dates are permitted. And I think there was some highlight. I'm not sure if we have Tim on the line, but I think there was some partial highlighted here.
Suggesting that the onset data types don't allow partial dates, like without string.
That was just a comment. I also agree that the data types do support these pretty easily.
For all the examples on the page, all of those are covered by the non-string data types, like the for example list.
Yes.
Arguably, 3 months old is, depending on how it was entered, but again, going back to our vendor poll, there's no way to do it that way. So, but yes, it's an age.
Does an onset allow an age?
It does.
Yeah, but I'm saying it
Age
depends
can
on how
be
that
a
was entered,
numerical
whether it was
value
literally,
with
yeah,
a time value like 3M. That can
Yeah.
do it.
it's how do you interpret that example, whether
Yeah.
you're interpreting it
I mean-
literally as a string or whether you're as a more structured age, number, and months, that kind of thing.
Yeah, I mean, if it was a string, we would
Which-
prefer them to use age, wouldn't we?
Yes.
Yeah, going back to what I guess Brett was, and what I'm saying here is the majority of the content for onset, even if it was entered as a string, at the moment, I suppose it forces a transform into the date time format, like 3 months. Even if you just typed 3 months and it wasn't originally captured in an age, FIRE would, to have that be valid, it goes into the FIRE format. So the question around the string data type, which is the other possibility, and that's okay, we've said non-persuasive because we can revisit if there is a need to, is we could have said not yet, let's do it later, and then what are the needs? And there would need to be, I think, if string was allowed, a significant set of guidance and rules around where and when string is acceptable.
And the agency, and I don't know if this has changed, but the agency is the only one that has stated that they support the 4, including age. And all the others have stated date time, and Oracle has stated they've got date time with some adjustments of about or around, so sort of estimation concepts, which is our extension.
Yep. Okay. Brett, I see your hands up.
Yeah, I'm just going to go back to use of note again because I think it's like I'm a big fan of not putting unstructured, like effectively it's an unstructured entry once you put it as a string, even though it's in a particular classification. So I'm actually a big fan of not allowing it just because I think you should put that stuff in notes. It's context. If you're not prepared to put a specific date in, then put it in notes, right? And like somebody will read it just the same as part of the complete information because it's must support. And that does make a whole lot of downstream handling and things like decision support and analytics a whole lot more readily achievable without having exception cases that need to be dealt with. Yeah.
Thanks, Brett. Would anybody else like to comment or question on this item? Hearing none, would anybody like to make a motion?
Do you want to put the disposition up?
Yeah,
Sorry, I just done
let's do
that.
that. Let's do that one.
I'm Landon Riley. I'm happy to put a disposition for this as non-persuasive for
So we'd
5.
like to motion that.
Yes, please. Sorry, I would like to motion that.
Okay. Who would like to second?
I'm happy to. Okay, you go.
I'll second. This is Andrew.
Okay, Andrew would like to second. Any other comments or questions about this item before we move to a poll? Okay, I will relaunch that poll. You should see that in front of you for affirmative, negative, and abstain. And the previous instructions hold around chats, use of chat. Okay, we've only got 66% who have voted. Need a few more. Still need a few more. Blank 3. Okay, 2 now. And we will wait until they vote. Okay, dokie. I'm going to count that down in 5, 4, 3, 2, 1. I will end that poll. I will share the results. With the vote in the chat, that becomes 13 affirmative, 0 negative, 8 abstain. The motion carries. Okay, I'll stop sharing. We can move on to the next item.
Great. Thank you very much. So this is the last in the chain. The only difference between this one and the previous ballot items is this one refers to abatement. But fundamentally, looking at the ticket, the way the description of the ticket, the comments, the votes, and the disposition, it falls exactly into line with the previous ballot items. So I probably won't rehash all of these because we've just been discussing it, but it's the same items. This also had a vendor survey and was related to the Zorlip poll. And ultimately, it's the same disposition as the other items that we landed on. So I think the only thing different about this is that it's abatement and it's not onset. And whether anyone has any comments around this particular element or if that is different in any way, feel free to speak up if there's any differences between this and the others that you can think of.
So that question is open to those on the line on whether or not there are differences here between particularly the condition onset and I guess the condition abatement to talk through. Are there any other comments or questions that people would like to raise at this time? Hearing none, would you like to make a motion, Landon?
Sure. I would like to make a motion that 52342 is non-persuasive.
With the reason on the screen.
With the reason
disposition.
with the current disposition. Correct.
Okay. Thank you, Landon. Who would like to second that?
I'll second. Heath.
Okay. Thank you, Heath. Are there any other comments or questions while we move to the vote? Okay, I am relaunching that poll now. And you should see that in front of you. Please vote affirmative, negative, or abstain, and put your vote in the chat if you can't vote, and say your name and affirmative, negative, or abstain if you have dialed in. Okay, 79% of voters. Need a couple more. Okay, I'm going to count that down in 5, 4, 3, 2, 1. I will end that poll and share the results. So what we have, including what's in the chat, we have 15 affirmative, 0 negative, and 6 abstain. So the motion carries. Thank you. Does that bring us to the end of the ballot reconciliation items for this meeting?
Yes, thank you. That does. That is all the items I was going to present. Now I shall attempt to stop sharing, unless you can just take over.
I probably can, but stop sharing is also good.
Perfect.
And let's finish up, because we also have to announce the winner, such that there is one, of the meeting time. Let's get there. That's what's next. Let me just present. Let's go see. Where are we? Where did we land? Okay,
Suspense is
that's going to
killing
take
me.
a while. Yeah, I know. I would make a drum sound, but I don't know how long it's going to take. Seems like a bit.
The suspense.
Okay,
Here it
okay.
comes.
Here we are. All right, we're here. Option
there you
2.
go. Got a winner.
Option 2 has won it. So, depending on where you are, that's what we're going to move to, and I will send out meeting invites tomorrow. Now, because our meeting series is finished. So yeah, I'll send out the daylight savings meeting series on this. Option 2 is our new times. All right, quite a clear winner. Thank you everybody for participating.
That means that there's no change. We keep on Australian Eastern Standard Time, right?
For the Queenslanders.
Or the change for those people who have daylight saving, but
Yeah.
Yes, that's right.
the time
Yeah.
practically is unchanged.
Yeah.
Yeah, so
It's
many states except like
everybody
one
else.
changed.
It's nice for us. It's nice for the Western Australians, because otherwise it's very early.
Yeah.
It means forced fasting for New South Wales.
So yeah, I'll send out that update tomorrow. We've got TBD time, but we've just announced it. Our next meeting, we're going to go through more ballot reconciliation, discussion, voting on JIRAs. The potential agenda is going to come out real soon, probably Monday next week. Well, actually not Monday, because that's a public holiday. I need to shift that. What we're also going to do is a block vote. So there's going to be a block vote coming out this Friday on the items that have been voted on the AU Core ballot that are things that the co-chairs have assessed as being basically new pieces of work that we need to go through, develop, test, and bring through a release. So they're being proposed by the AU Core TDG co-chairs to the community as things that we can't solve now because we're basically in publication mode, and need to be worked through in our next go round if people are interested to do so. So that's going to come out this Friday. And then there'll also be an announcement on, like, it's going to be Tuesday because Monday is a public holiday for like everywhere but Victoria, as far as I understand. So maybe Tuesday there'll be an announcement of what the next sort of like ballot items are that we can go through and meet on. I think that's where we are. Are there any other items that people want to discuss in our like 3 minutes remaining? All right, I'm not hearing any. So I might bring the meeting to a close there. Thanks everyone. We got through the ballot reconciliation agenda for today. And yeah, you'll get some comms coming out from me post this meeting for what's coming up next. Thanks everybody.
Bye all.
Thank you.
Thanks a lot.